Hello students, I am Professor Dr. Adarsh Kumar. Today I bring you the next learning episode in BSc Forensic Science on an important unit of paper Forensic Anthropology, that is genetic and congenital anomalies. Today in this lecture you will be introduced to the concept of genetic and congenital anomalies and how they help in the process of identification. You will also learn about various types of chromosomal variations like Klinefelter syndrome, Turner syndrome, 47XXX syndrome, 47XYY syndrome and Down syndrome, that is also called as trisomy 21st. Also you will study the types of congenital anomalies or malformations like isolated generalized conditions, spinal defects and clefting. So, let us start our module with a look at what we are going to learn today. Module 1 will be the introduction of genetic and congenital anomalies. Module 2 will cover with the various types of chromosomal variations. Module 3 will cover in detail the types of various congenital anomalies or malformations. Module 4 will be the concluding module. Basically, whenever we want to have any identification of a person, then these conditions also affect and help in the identification process. This module has been divided into two. In first we will cover the chromosomal abnormalities and in the second part we will cover the congenital anomalies. So, let us see the first part. As we know that the genetic material in an organism is delicately balanced and hence small or minor alterations in this genetic material or in the genetic information's location within the genome can result in some form of phenotypic variation as well. The genetic anomalies are caused due to mainly the chromosomal aberrations or mutations, which include modifications in the total number of chromosomes or the deletion of any chromosomal segment, or when chromosomal segments or genes are duplicated, or when rearrangements take place in the genetic material either among the chromosomes or within it. Also, as the main unit of genetic transmission is the chromosome, thus in accordance with the Mendelian laws, the chromosomal aberrations is passed to progeny in a predictable manner, resulting in many unique genetic outcomes. Variation in chromosome number ranges from the addition or loss of one or more chromosome to the addition of one or more haploid sets of chromosome. So, as we will discuss the various types of genetic anomalies that include the loss or gain of chromosomes and to examine how such anomalies result. For example, when the chromosomes are altered, how do they result in the various syndromes? The gain for that matter, say it will lead to formation of 47, that is XXY, or loss, that is for example 45 chromosomes where only X is there and the Y component is missing, of an X chromosome from an otherwise diploid genome affects the phenotype, resulting in Klinefelter syndrome in XXY or in Turner syndrome, that is XO respectively. The human females may contain extra X chromosomes also, for example 47XXX or 48 tetra X, and some males contain an extra Y chromosome, again it will lead to formation of 47, but then it will be XYY. So, this process disrupts the normal distribution of chromosomes into gametes and hence abnormal gametes can form containing either two members of the affected chromosome or none at all. Fertilizing these with a normal haploid gamete produces a zygote with either three members, that is called as trisomy, or only one member, that is called as monosomy of this chromosome. In case of humans and other organisms, aneuploidy conditions result due to non-disjunction of chromosomes. Humans, as we all know, contain 23 pairs of chromosome, out of which one pair vary in configuration in males and females, that we all know, 44 plus XX or XY. So, these two chromosomes are designated as X and Y chromosomes. The human female has got two X chromosomes, so that is 44 plus XX, and the human male has got one X and one chromosome, one Y chromosome. So, that means 44 plus XY chromosome. Scientists identified these two human abnormalities characterized by aberrant sexual development, that is Klinefelter syndrome there, that is 47 number of chromosomes are there, an additional X chromosome is there. So, it will be the XXY, and Turner syndrome where one chromosome is missing, Y component is missing. So, it will have basically only 45 number of chromosomes, only X is there and Y is not there. We will take one by one these syndromes. The Klinefelter syndrome. Individuals with Klinefelter syndrome have more than one chromosome. In addition to 44 autosomes, they also have the XXY complement. Most often they have an XXY complement in addition to 44 autosomes, which is why people with this karyotype are designated as 47XXY. Individuals with Klinefelter syndrome are generally tall and have long arms and legs and large hands and feet. They usually have genitalia and internal ducts that are male, but their testes are rudimentary and fail to produce sperm. At the same time, feminine sexual development is not entirely suppressed. Slight enlargement of the breast, that is gynecomastia, is common and the hips are often rounded. This ambiguous sexual development, referred to as intersexuality, can lead to abnormal social development. The intelligence is often below the normal range as well. The other common is the Turner syndrome. Individuals with Turner syndrome most often have only 45 chromosomes, including just a single X chromosome, thus they are designated as 45X. In Turner syndrome, the affected individual has female external genitalia and internal ducts, but the ovaries are rudimentary. Other characteristic abnormalities include short stature, they are usually under 5 feet, cognitive impairment, skin folds on the back of the neck and underdeveloped breasts. A broad shield like chest is sometimes noted. Turner syndrome is observed in about 1 in 2000 female births, a frequency much lower than that for the Klinefelter syndrome. One explanation for this difference is the observation that the majority of 45X fetuses die in utero and are aborted spontaneously. Thus, a similar frequency of the two syndromes may occur at conception. Another condition, that is 47XXX syndrome, that is also called as super female. The abnormal presence of 3 X chromosomes along with a normal set of autosomes leads to formation of 47 number of chromosomes XXX, results in female differentiation. The highly variable syndrome that accompanies this genotype, often called as triplo X, occurs in about 1 of 1000 female births. Frequently 47XXX women are perfectly normal and may remain unaware of their abnormality in chromosome number unless a karyotype is done. In some other cases, mental retardation, sterility, underdeveloped secondary sexual characteristics and delayed development of language and motor skills may occur. Then XYY syndrome, of course, the number remains the same 47. So, it is called as 47XYY syndrome. Another human condition involving the sex chromosome is this. In this, there occurs this only deviation from diploidy is the presence of an additional Y chromosome in an otherwise normal male karyotype, as we have 46XY. These males were significantly above average in height and had been incarcerated as a result of antisocial or non-violent criminal acts. These are of subnormal intelligence and suffer personality disorders. The possible correlation between this chromosome composition and criminal behavior piqued considerable interest, and extensive investigation of the phenotype and frequency of the 47XYY condition in both criminal and non-criminal populations ensued further. They are usually of above average height, over 6 feet, and have subnormal intelligence, and have been generally substantiated, and the frequency of males displaying this karyotype is indeed higher among people in penal and mental institutions than among unincarcerated populations. Another syndrome is the Down syndrome, that is also called as trisomy 21st. The only human autosomal trisomy in which a significant number of individuals survive longer than a year past birth was discovered in 1866 by scientist Langdon Down. The condition is now known to result from trisomy of chromosome 21st and is called as Down syndrome or simply trisomy 21st, designated as 47-21 plus. Typical of other conditions classified as syndromes, many phenotypic characteristics may be present in trisomy 21st, but any single affected individual usually exhibits only a subset of these. In the case of Down syndrome, there are 12 to 14 such characteristics, with each individual on an average expressing 6 to 8 of them. Nevertheless, the outward appearance of these individuals is very similar, and they bear a striking resemblance to one another. This is for the most part due to a prominent epicanthic fold in each eye and the typically flat face and a round head. People with Down syndrome are also characteristically short and may have a protruding furrowed tongue, which causes the mouth to remain partially open, and short broad hands with characteristic palm and fingerprint patterns. Physical, psychomotor and mental development are retarded, and poor muscle tone is characteristics. While life expectancy is shortened to an average of about 50 years, individuals are known to survive into their 60s also. In the way of further illustrating the impact of just one additional chromosome in an otherwise diploid genome, children afflicted with Down syndrome are prone to respiratory disease and heart malformations, and they show an incidence of leukemia approximately 20 times higher than that of the normal population. In addition, death in older Down syndrome adults is frequently due to Alzheimer's disease, the onset of which occurs at a much earlier age than in the normal population. Besides Down syndrome, only 2 human trisomies and no monosomies survive to term. They are called as Patau syndrome and Edwards syndrome, that is 47-13 plus and 47-18 plus respectively. So, Patau is 13 plus and Edward is 18 plus. Even so, these individuals manifest severe malformations and early lethality. Structural or functional abnormalities which may occur during intrauterine life are known as congenital anomalies. They are also called as congenital malformations or birth defects, and if they are present, they are highly diagnostic or characteristic in individualizing a person. Identification of these can be made prenatal at birth or later in life. They have variety of causes such as pregnancy, birth complications, genetic malformations or viral infections. Sometimes the cause of these anomalies is not known. Various genetic and environmental issues may result in these congenital anomalies. Various errors of infection, epigenetic modifications, morphogenesis or chromosomal abnormality lead to such defects. According to previous studies, mothers and fathers' diet, glucose levels before ovulation and conception, vitamin intake lead to long term effects on the growth of the fetus. Father's food habits, germline mutations, alcohol use, chemical mutagens, age, smoking habits and epigenetic alterations can lead to such anomalies. Congenital anomalies or malformations can be broadly divided into 4 categories: isolated conditions, generalized conditions, spinal deformities and clefting. So, I will take one by one. Isolated conditions. These conditions are divided on the basis of their anatomical location. These conditions may or may not occur together with other different types of congenital anomalies. First, involvement of the shoulder girdle. It is usually related to congenital anomalies of cervical and upper thoracic spine. It is also known as Klippel-Feil syndrome. It can be unilateral or bilateral. When it is due to birth trauma of brachial nerve plexus, then it is found unilateral only, but if it is due to hypoplasia of glenoid due to growth disturbances, then it is found on both sides. Second deformity is called as wrist maldevelopment or the Madelung deformity. This is V-shaped deformity of wrist. This is called as Madelung deformity, which is caused due to growth disturbance of the medial aspect of the distal epiphysis. This is mostly found in females and is commonly revealed in teenage years. The main reason for its occurrence is the localized trauma or infection, which causes premature fusion of part of the growth plate. Then there could be duplication, hypoplasia as well as agenesis of upper limb bones. Various congenital upper limb anomalies can be encountered from minor to severe ones. One of them is the duplication of bones. Other may include hypoplasia and agenesis, which affects the upper limb bones in diagonal or longitudinal manner. Some syndromes which are associated with congenital heart disease may show radial hypoplasia. Synostosis, that is congenital fusion of bones, is mostly found in the wrist. Then there could be congenital dysplasia of the hip. One of the most common site of congenital dislocation is the hip joint. So, ball and socket joint is present in the hip. If the ball of the femoral head is not retained within the socket during growth, the acetabulum will fail to develop and will appear abrupt and narrow. A false acetabulum with lateral ilium is developed if congenital dislocation of hip is imperfectly treated. Since femoral head will migrate upwards, this false development will take place. Then next disease is the Parthes disease, also called as coxa plana. There occurs in proximal femoral epiphysis, undergoes osteonecrosis in children between the age of 4 to 8 years, and which leads to this type of disease. Occurrence of this disease varies with the geographical area and is commonly seen in boys. In about 10% of the cases it is bilateral, but it does not start at both sides at the same time. Symmetric radiographic appearances cannot be observed, and it becomes an important feature in differentiating between Parthes disease and other conditions like cretinism or epiphyseal dysplasias with a fragmented proximal femoral epiphysis. In advanced stages of this disease, increased sclerosis, flattening and fragmentation of proximal femoral epiphysis can be seen. Secondary growth disturbances of the acetabulum and irregularity of the proximal femoral metaphysis is observed in severe cases. Then we can have slipped upper femoral epiphysis, also known as slipped capital femoral epiphysis. This occurs mostly in the adolescent age group. The femoral head gradually slips posteriorly, medially and inferiorly with respect to the neck. Due to shear stresses, this slip occurs when growth plate is weak, most commonly seen in boys as compared to girls, and about 30% of the cases it is bilateral. Some of the observations include blurring of growth plate, decreased height of femoral epiphysis and medial migration. The slip is readily apparent on the frog lateral projection. Another condition is the proximal focal femoral deficiency. It is a rare congenital anomaly characterized by fluctuating degrees of hypoplasia of the proximal third of the femur. Then there could be congenital tibia vera, also called as Blount's disease. It is a condition which affects the development of medial portion of the proximal tibial growth plate. It is of two types, unilateral or bilateral. In case of improper growth of medial tibial epiphysis and metaphysis, progressive deformity of knee develops. In case of premature fusion of the medial aspect of the proximal tibial growth plate occurring due to inflammation or trauma, a similar type of deformity can be observed. Then there could be ball and socket ankle. In this disease, the ankle joint develops into a ball and socket appearance. Curved articular surface of lower tibia and upper talus can be seen. The condition very frequently found is talipes equinovarus, also called as club foot. It can be hind foot equinus, forefoot varus, hind foot varus and high arch are some of the deformities which can be seen in neuromuscular disorders as well. Then vertical talus, it is a congenital anomaly with extreme plantar flexion of the talus and dorsal dislocation of the navicular. It leads to rigid flat foot. Then tarsal coalition, a single structure is formed by fusion of two or more tarsal bones in this anomaly. The fusion may be complete or incomplete and the bridge formed may be osseous, cartilaginous or fibrous. In spite of the fact that it is a congenital disease, its symptoms appear in adolescence or early adulthood. Fusion of the middle subtalar joint between the calcaneus and talus is most commonly seen. Occurrence of multiple variations can be seen. Then there could be duplication, hypoplasia and agenesis of foot bones. Various types of congenital abnormalities of bones of foot can be seen similar to upper limb disease. It includes duplication, agenesis and hypoplasia. Since the functioning of foot is less sophisticated as compared to upper limb, the problem caused are comparatively fewer. The other category under the congenital malformation are the generalized conditions. The various rare birth defects are present which can affect the skeleton to a huge or less extent. Radiographs are required for establishment of correct diagnosis. They are generally classified as skeletal dysplasia. Most conditions fall into the following broad categories such as dysplasia with predominantly epiphyseal involvement, with or without spinal involvement, dysplasia with predominantly metaphyseal involvement, again with or without spinal involvement, dwarfism, storage disease, inherited metabolic disorders, dysplasia with reduced bone density, dysplasia with increased bone density, tumor like dysplasia and malformation syndromes, etc. We will see some of the common ones. First is the multiple epiphyseal dysplasia. Here in this, premature degenerative changes are caused due to symmetrical irregular growth of epiphyses. Then achondroplasia, it is the most common type of short limbed dwarfism. The proximal segments of limb are shorter than the distal segment. For example, femur is shorter than tibia and fibula. This flared metaphyses and normal epiphyses can be observed with shortened long bones. The iliac bones appear squared with horizontal acetabular roofs. The interpedicular distance between increase from upper to lower limb in normal individual, but in this condition it decreases. The adult achondroplastic dwarfs have more chances of developing multiple level spinal canal stenosis which cause nerve root irritation, paraplegia and paraparesis. The third condition is the osteogenesis imperfecta. Here in this, bone density is severely reduced. It is a connective tissue disorder. Due to reduction of bone density, over-tabulation of long bones and multiple fractures can occur which have slow healing and leave marked residual deformity. There are various forms of the disease. Babies suffering from severe condition are usually stillborn or die early. Infants who survive have less severe form. Then there could be another category, broad category are the spinal deformity. The commonest is the scoliosis. Scoliosis may be idiopathic, congenital, neuromuscular and others which includes trauma, infection and tumors as well. The idiopathic scoliosis constitutes about 70% of cases are of this type. It is again of three types depending upon age presentation, that is infantile, juvenile or adolescent. 85% of cases are seen in adolescent, in which number of girls affected is comparatively more than boys. It usually involves the thoracolumbar spine with the convexity of the principal curve to the right. Then congenital scoliosis, in about 10% of the cases are of this type. It is caused due to underlying congenital vertebral abnormalities. Hemivertebra, that is failure of formation of vertebra, or spina bifida, that is the failure of segmentation of vertebra, are included in it. There is a recognized association of congenital scoliosis with other abnormalities such as tethering of the spinal cord and diastomatomelia, where the bony or fibrous bar occurs across the spinal canal. Then very common finding occurrence of a congenital malformation is clefting. During the gestation period, facial and oral malformations can occur which result in cleft lip or cleft palate or both. If we see the chronology, the formation of lips occur between 4 to 7 weeks of pregnancy. If sufficient tissues are present in the mouth or lip area and the tissue available does not join properly, it results in clefting. We will see one by one. Cleft lip. First is the cleft lip. The physical split or separation of two sides of upper lip which appear as a small gap in the skin of the upper lip is known as cleft lip. It usually extends beyond the base of the nose. Bones of upper jaw or gum are included in it. It can be categorized as incomplete or partial cleft lip in which the top of the lip has a small gap, and complete cleft lip in which the gap continues till the nose. It can be again unilateral, that is present on one side only, or bilateral, present on both sides of upper lip. Then there could be cleft palate when there is a split or opening in the roof of the mouth, that is the palate, then it is known as cleft palate. It may involve hard palate or soft palate. Cleft palate can occur as complete in which gap is present in soft and hard palate, possibly including a gap in the jaw, or incomplete in which there is a hole in the roof of the mouth, usually as a cleft soft palate. It can also be unilateral or bilateral. Then third category could be the combination of both, where the cleft lip as well as cleft palate both occur. They can occur on both sides of the mouth. Since the lips and palate develop separately, it is possible to have only cleft lip or cleft palate or both. In case of cleft lip and cleft palate, both the lip and palate have a split. It can occur on one or both sides of the mouth. The genetic anomalies are caused due to chromosomal aberrations or mutations, which include modifications in the total number of chromosomes, the deletion, or when chromosomal segments or genes are duplicated, and when rearrangements take place in the genetic material either among the chromosome or within it. The gain, for example 47XXY, or the loss, for example 45X of an X chromosome from an otherwise diploid genome affects the phenotype, resulting in Klinefelter or Turner syndrome respectively. Monosomy is the condition that produces 2n-1 complement due to the loss of one chromosome. The Down syndrome, that is trisomy 21st, Patau syndrome, that is trisomy 13th, Edwards syndrome, that is 18th, Cre-Du-Cat and Fragile X syndromes are other genetic abnormalities. Structural or functional abnormalities which may occur during intrauterine life are known as congenital anomalies or malformations or birth defects. These are broadly divided under 4 categories, that is isolated conditions, generalized conditions, spinal deformities and clefting. Achondroplasia is the most common type of short limb dwarfism. Bone density is severely reduced in osteogenesis imperfecta. Scoliosis may be idiopathic, congenital, neuromuscular, as well as including traumatic infections and tumor. During the gestation period, facial and oral malformations can occur which result in cleft lip and cleft palate or both. The physical split or separation of two sides of upper lip which appear as a small gap in the skin of the upper lip is known as cleft lip. When there is a split or opening in the roof of the mouth, that is the palate, then it is known as cleft palate. With all these information, here we come to the end of today's lecture. Do keep in mind what we discussed today. I will be back with one more lecture in this series. If you want to learn more and enhance your knowledge, you may log on to our website, that is www.cec.nic.in for MCQs, quizzes, LORs, etc. Thank you for your time today. I will see you in the next lecture. Have a great day.